We are recording now, and I'm not sure who wants to start this. Carol, do you want to start it? I'm letting Lana Ritchie in right now.
Okay. Today we're wanting to talk about employees who are interested in moving to a GoHire employment. And so we wanted to open the floor up and give you guys an opportunity to ask questions. And hopefully we'll be able to answer those questions. And if we can't, then we will get together and try to come up with an answer for those questions. But today is just time to learn more about GoHire and what a transition to GoHire employment would look like for current employees. Does anyone have any questions that they would want to talk about yet, or do we want to have someone from GoHire do their presentation?
Hey, Sean, before we keep going, it may not matter, but you currently have it to where your video is locked, where you're the only one that can be seen. It should be set to where whoever is speaking, it's just to their screen.
I think each individual computer, you have to set that on your own screen. I think up in the top right-hand corner, you can set it to gallery view or speaker view.
Okay.
All right. And I can just turn my video off. I'll turn my microphone off too. Just kind of coordinate behind the scenes. If people want to ask questions, just tell them to type into the comment box and I will unmute them so they can ask their question.
All right. If you wouldn't mind to unmute Laura, Christy, and Krista and Brandon, please, and we'll go ahead and get started with them to tell us a little bit about GoHire.
Do you want me to go ahead and start?
Yeah, if you wouldn't care, please.
I'm not sure Laura can hear it.
I'm sorry, what?
I see Laura Ritchie signed in. I unmuted her.
Okay. Krista, would you care to go ahead and start?
I will. Hello, everybody. My name's Krista White, and I'm the president of GoHire Employment and Development. GoHire is a nonprofit 501c3 organization, and we organized in October 2010 and started with our first contract January 2011. And that contract was a community mental health center. During our first year of business, we began with around 360 employees. And now we are at over 980 employees and growing. We started in an 8-county region in southeast Kentucky, and from that time have branched out across the state. And our contracts have included community mental health centers, extension offices with the University of Kentucky, local health departments, and some small manufacturing companies and construction businesses. So we have done everything in the scope of employment, from just basic recruiting and screening to full scope personnel management of every type of position, from general laborers up through medical doctors and psychiatrists. And our most recent endeavor has been with health departments across the state. So that's how we have became connected with you guys today. So we do everything from the first step, which is advertising positions, recruiting for positions, up through the employment process, which includes benefit administration. And did everybody get a chance to look at the employee benefit guide and the questions and answers that Carol had put together? Carol,
The
do you
ones
know
here
if
in-
folks had a,
I think they have. I know the ones sitting here have, and I've had several questions, and I think some of them are like Cumberland agency related, and then the others I think we've passed to you, and you've done the frequently asked questions. So I think it would be interesting to see if anyone had anything further that they wanted to discuss or get more information about. I know that there were some questions about raises yesterday. There were some questions about bonuses and those types of things. So Sean or Ron may want to talk a little bit about that with what decisions have been made there with in respect to that. The other thing that was asked was about the leave. Based on their classification, what that would look like, how they would be classified. And I believe, I think it was you and I had a discussion that we would have to classify similar to what other health departments had classified their staff, just for cohesiveness. So each individual that's interested in making that transition to GoHire employment would just need to reach out to us to find out how they would be classified. But if you want to talk a little bit about how that rationale works, they may be able to figure out some of that for themselves.
okay. Paraprofessional and professional is a classification type that we use. It's used to manage two things. One is, of course, the PTO than paraprofessional staff. And then by the same virtue, professional staff are required to give 4 weeks notice should they decide to end employment. And paraprofessional staff are required to give 2 weeks notice.
Sorry, Petri. I accidentally muted you for a couple seconds there when you
Okay,
started your comments. So could you kind of repeat that, please? I'm sorry.
I can, that's okay. Paraprofessional and professional are classification types that we use for two purposes. One is the PTO accrual, and two is the resignation notice requirement. Professional staff accrue leave or PTO time at a higher rate than paraprofessional staff. Professional staff are required to give 4 weeks notice should they decide to end employment, and paraprofessional staff are required to give 2 weeks notice. Now, the way that we determine who's professional and who's paraprofessional, there's several factors that go into that. Paraprofessional staff are typically your entry-level staff or your general labor or general service area staff. Those are things like housekeeping staff, service workers, receptionists, clerks. Typically aides are in that category, or your level 1, level 2, your lower level employees are in the paraprofessional. Professional goes into your higher level administrative staff typically who supervise 2 or more staff. They have an independent level of functioning or a specialized credential such as registered nurses, social workers, counselors, or your executive level administrative staff. So those are the factors that are used in determining that class. And the employee benefits guide spells out, it has a table in there that shows you the amount of accrual for each, the paraprofessional and the professional. And that accrual does increase with longevity, and that's also identified in the table. Any other questions about that?
If anyone has a question, just remember to just type in the comment box that you have a question. I'll be glad to unmute you and let you ask it. Carol had made a comment a moment ago about what would we do as far as raises in the agency. You know, it's our intention to try to treat GoHire employees as much like our own employees as we can. So, you know, if the board gives the retirement system, merit system employees a raise, you know, that would be something that we would also look at doing for our, you know, our GoHire employees. So.
And all we would need in that case is authorization sent to us from Mr. Crabtree, and then we would gladly process those. You have a quiet group.
Yeah, I don't know, maybe they're just listening in out of curiosity, but you know, seriously, if there's anyone out there that you're considering doing this and you're on the fence because there's something you don't understand, please ask now. You know, we want you to be fully informed, and you know, we know this is different, so there's things you have to take into account if you stay. There's things you have to take into account if you go. And, you know, those aren't exactly equal. So, you know, we want you to be able to make an informed decision. So if there's anything at all you're confused about, please just ask. I mean, this is why we're having this, is so you guys can have clarity about the issues. All right, I see Christy Parmalee has typed a question. It says, do we stay at our same pay rate, or is it different if we switch to GoHire? In the email, a 10% raise was mentioned. Yeah, we were, you know, there's a savings to the agency because the benefit package costs, you know, there's a less expense to that. So, you know, as an incentive to the employees to make the transition, you know, we were considering doing the 10% raise, 10% more than where you are now. So, so that's what we were looking at doing. I think probably several other health departments across the state have done something similar to that.
Yes, they have.
Yeah, and you know, we also talked about like other health departments did. You know, if the employee needs to, in order to keep their insurance going until your insurance kicks in, that the agency would go ahead and try to pay, you know, continue to you know, pay the employer portion. And so we're just trying to bridge the gap for the employee, so they're not they don't have a lapse in coverage and aren't having to pay the, you know, the employer portion of their insurance through.
Correct.
That was something else. Ron, did we talk about any other benefit? I know Carol and I had been talking about, you know, in our system, if someone resigns, we pay out their annual leave in a lump sum, and their sick leave, that doesn't get cashed out, but you know, it continues to live in the you know, in the retirement system, as you know, as long as you don't cash in your retirement, it stays there. You know, we had sort of talked about maybe, since you know, everyone would be cashing out their annual leave, just maybe purchasing a certain amount of annual leave for each person, so they could start out not at zero. I don't know if we would just, you know, this would not be, you know, I don't know how you say whether it's fair or not, but you know, maybe just saying for everyone we would purchase 5 days or something, just so that they didn't have to start out at zero on their annual leave.
And we have had several of agencies do that. And it's awarded as a hiring incentive at the time of hire and placed in the bank.
Yeah, and what does most agencies purchase? Does 5 days sound like a
We have had it, and Brandon, correct me if I'm wrong, we have had it be everywhere from 5 days up to 30 days. It just depends on the facility.
Yeah, well, I guess that would depend on the, when we looked at the group and saw how much they had. I know,
Correct.
we would be paying out their annual leave, so it's not like we're cheating them out of their annual leave. So, it's just trying to give them something so they're not completely.
Yes.
In my mind, 5 days sounds.
Yes.
I don't know.
And that's common. And just to add, if I may, about GoHire, just as a comfort level for folks, I would say that, GoHire was organized as a nonprofit with the specific intent of assisting other nonprofits and community service organizations in managing the challenges that we're all faced with now. Is how do you afford to operate, and how do you afford to provide affordable benefit structures and still be able to provide a level of service to the community. So our intent is to be a help, not to come into anybody's business or anybody's workplace and take over anything or disrupt anybody's daily activities. I think that that's often a point of pause for staff is, what does this mean? What's this going to mean for me on a daily basis? And, we don't intrude on any of that. We strictly stay in that personnel, employment, benefits management area.
I see Brandon typed a message to everyone that said no purchase required on the 5-day PTO incentive. Time off would be invoiced when it was taken by a staff person. No upfront purchase required. So I guess what Brandon's saying is, and I've got him muted right now. Brandon, I don't know if you want to be muted or not. I've fooled around and muted everybody. I've got you unmuted now.
Can you hear me now?
Yeah, but what you're saying is we could just give the 5 days and you would invoice us as they used them.
Yep. Yeah, you had said purchase, so I didn't know if you were thinking there would be like an upfront cost to that, but there would not be. No upfront cost to the agency.
All right, and I unmuted Laura Ritchie too. Does any other employees have any questions about any of this? I can only assume if you're not typing in a question, you understand everything crystal clear and are informed enough to make your decision. If you're not, that's okay. I'm sure Krista would be willing to answer any question that you guys have, and I'm sure Carol would too. So let's see, Christy Parmley typed, what happens if we've already paid to what we've already paid toward our retirement? Carol would probably might be better able to answer that than me. I'm going to unmute her. Carol, you want to answer that?
So it would say typically when someone resigns from the agency, that their time that they've paid in remains on the books for when they do retire, and then they would claim that through the KRS system for whatever time that they have. So the short answer is that it remains on the books to be used for when you do retire. And you would need to contact KRS to find out the specifics about that. But it is not paid out right now. And I do know that KRS does offer some different options to people who leave.
I know some employees, when they change jobs, when they leave state retirement and go into a different position, some people leave the time there and then they cash it in when they don't cash it in. They claim it when they reach retirement age. They go ahead and retire from Kentucky retirement whenever they qualify, and they could, they could receive benefit from that time they have invested on, however much that is. And then some employees choose to, when they leave the state retirement, they just want the money and they cash it in. There's a substantial penalty to cashing in your, I don't know what it is, 20%, 25%. It's pretty substantial, but a lot of people do cash it in. They just get to where they need the cash and they cash it in.
It looks like Christy also had a question about mileage reimbursement, and she wants to know if that stays the same. I'll leave that to GoHire to answer.
Yes, it stays the same. We will update that quarterly in accordance with the updated rates from the state's website. And I believe the next update will be October 1st. Is that correct, Brandon?
Yeah, I believe so.
September quarter. Yes.
The only thing that might change is the reimbursement schedule. I don't know what you guys are currently on, but our schedule, travel is reimbursed on the 10th of the month, the 10th of the following month. So July travel checks would go out no later than August the 10th.
Yeah, the way that we do, the employees that travel, they're getting basically a check every week. One week they get a payroll check, the next week they get their travel check. They turn in their travel and time on the same time, the same 14-day time period is the same 14-day travel period. So they turn it all in on one combined time travel form, and we pay out the time one week and the travel the next week.
So it sounds like that's going to be just a little bit different on the reimbursement schedule.
Yeah, you all would be reimbursing once a month on the 10th, whereas we basically reimbursed every other week.
Yep.
Great.
Okay. So there's good and bad to that. I mean, that means you get a bigger check. That also means you have to wait, 4 weeks instead of 2. But all right, somebody else. What happened to? Let's see. I know. Well, let's see. What have we already paid toward retirement? Does our mileage reimbursements? Okay, I know the holiday pay is the same, but what happens when the health department is closed for weather and employee uses leave time? We'll GoHire reimburses for this. I saw an email Krista sent the other day. If I actually declare that the health department is closed, I'm the only one that has the authority to close the health department. And if I actually close it, the employees get paid other leave, and that counts as a paid day off for them. I would just send Krista an email, or Carol would, and she would count that as a other paid day for you guys too. That is correct, right?
Yes, that is correct. You would just code on your timesheet OPL, which means other paid leave, and the reason would be inclement weather. And as long as that was approved, and Mr. Crabtree did close the facility, then it would be another paid leave day. But the only time that it would be a PTO day is if, you had not technically closed the facility and the employee made the personal decision that, well, it's bad for me to travel, out of where I live. Then that would be a PTO day.
Yeah, and that's the way we do it too. When you say PTO, you mean personal time off, I think.
Correct.
That's what we would call vacation leave or annual leave in our system. That's what I tell the employees. Just because I'm leaving the facility open doesn't necessarily mean it's safe to travel wherever you happen to live. If you choose to stay home and we're not closed, you have to count annual leave for that. And we've been generous to approve that because we want the employees to feel safe.
Correct.
Chris, there's times that, like I may just open on a delay, or I may close on a delay. So I may give the employees like 2 hours of other leave for because we open on or close on, open late or close early because of the weather. And that would be the same thing. I assume they would be able to count those 2 hours also, correct?
Yes, that is correct. And you know, we would just need that email, like you said, from either you or Carol to let us know. So that way we can let the payroll department know that that's approved, and they know that that other paid leave code is okay when they see it on the timesheet.
It gets tricky for us, King County District. You know, it may snow in Macquarie County and maybe sunny and dry in Taylor County. So,
Yeah. We know how that goes too.
yeah, I may open 2 hours early or 2 hours late in Macquarie and run normal time in Taylor. So, you know, that I know the employees sometimes feel like that's cheating them, but I can't be responsible for an act of God.
That's correct.
And, you know, we have a responsibility to our patients. So if it's sunny in Taylor County, we need to be open. And if it's snowing in Macquarie, we may need to be on a delay. So, I can't just let people off in Taylor because it snowed in Macquarie, you know, because those employees get 2 hours. That's what I'm getting at is that benefit wouldn't always be across the board to every employee. It would be situational to what county they're working in. So any
Yes.
on your own.
We understand that, and we can absolutely work with that. Like I said, as long as we know from you what has been authorized, then we're good with it.
All right. The next question says, if you decide to transition to GoHire, when would this start? You know, the legislature just delayed our retirement thing going up to 87%. I still think there's a savings for us, even if we go forward with the transition now. So with the meeting today and the meeting tomorrow, next week, I'm going to think more about what we want to do. I'll probably do some sort of follow-up email with the employees and get in my mind what number of employees is really interested in this, and then kind of base my decision on how many people we really got interested and all that. So it's something that we will very likely do. I've already gotten approval from the state and the board to do this, and I'll need to just gather all the information before. Anyway, you're saying when we do it, it would be really soon. I don't want to delay on it. It would be within, let's say, 4 weeks or something. And no, Carol's saying no. When would it be, Carol? Are you answering my question or someone else's?
I was answering Ron's question. I'm sorry.
I'm saying, I would probably aim at we got to give enough time for everyone to do the transition. I know we talked about with GoHire, you have to time when you do this so that employees not without insurance any longer than they have to be. So, there's a certain day of the month that works really better for this transition model than others. So, if the agency was going to be picking up the tab for the COBRA, we would probably want to pick it up for 4 weeks instead of 6 weeks. So, we would time it so that we would only have the 4 weeks of COBRA we'd have to carry. But so, sometime in the next 4 to 6 weeks, we'd probably try to make this happen. All right. They got another question. Whitney says, are GoHire employees eligible for yearly raises if the health board votes to give an annual raise to merit employees? Our intent is to try to treat the GoHire employees as much like we've treat any other employee. You're not technically our employee at that point. You're the employee of GoHire, but we know to keep people that's doing business inside our facilities happy. If you start showing favoritism to one group over another group, that doesn't lend itself very well to morale, and so our intention would be to treat the GoHire folks just like we do others. And if the board approves a raise, we would send the information to GoHire and adjust the amounts for you guys too. Carol and okay.
I have a question that I've been asking, and you may want to address that as well. Several employees have asked, is this a one-time only window, or if we were to do the transition in 4 to 6 weeks and they decided in February of next year that they wanted to move, would we still consider the same incentives that we're offering the people now, or is this a one-time only opportunity for this?
I don't consider it a one-time opportunity. If they change their mind and want to transition over, that would be fine. The problem would be if they get over there at GoHire and decide they want to transition back. That's probably not going to happen, you know. So I say that because, you know, we've pretty much transitioned now to hiring new hires through GoHire. And, you know, that's the model we're going to be using because of the financial benefit to the agency. So, you know, when someone leaves the merit system, that position would be gone, and if we make a position available, it would be made available through GoHire. So the answer to the question is no. I wouldn't consider this a one-time only opportunity. If you think it through and decide 5 weeks later, hey, I wish I'd have done this, just gotta let it go. Let's see, Christy Parmley ask again. Ask another question. You go in as a new hire, not with the amount of years you already have under your belt. You know, at that point, you would no longer be the health department's employee. You'd be GoHire's employee, and GoHire starts their employees out at, you know, whatever place they are the day they start. You know, on day one, you're a day one employee. It would be like transitioning to any other you know, job. You start on day one at day one, and I guess I'm answering that clearly. You would not be our employee any longer to have. You wouldn't be an LCDHD board hired employee any longer to have accrued time. Your time would be accrued then through your current employer, GoHire. Does that make sense, Christy? Does anyone, Carol or Krista or anybody have anything to add to that? Brandon, anybody?
You are correct. As far as like PTO accrual time, it does start with day one as a new employee. So was the question in relation to PTO accrual, or was there maybe some other concern related to the seniority?
I'm not sure Krista can answer it. It may have been, you know, there's some seniority security. You know, if we ever had to do a restructure plan in the agency, you know, seniority is one of the factors we use when looking at that. So maybe that's the angle. I don't know. Christy, can you clarify? I don't see a follow-up question yet, but so maybe that means we answer her question. Does anyone else have any other questions? You're asking very fine questions, so keep on asking. Can you request time off without pay if you don't have PTO?
Yes. The same process would apply. When employees go through orientation, they will be trained on the leave request form, and the leave requests do go to the site supervisor for approval. And if a person is out of PTO, then leave without pay can be requested. And of course, you know, that would be, you know, the site supervisor initially authorizing that as far as, you know, for scheduling purposes. And we do have folks who utilize leave without pay. The only issue is if, you know, leave without pay becomes problematic for the work site. For example, you know, if somebody just constantly burns up all of their PTO and they're using leave without pay such that they're not dependable for work, then that would be an issue of concern. Otherwise, that is a process that we do utilize.
Yeah, I can say from the health department perspective, as the director, I'm the only one that's by statute or by regulation authorized to approve leave without pay, and I do it very rarely, you know, because our benefit package is really generous as far as accrual time, and we're pretty generous about allowing people to take their time when they request it. So, you know, there are a rare occasion when someone will, you know, maybe go through maternity leave or whatever, and they just run short. Of course, that would be FMLA, I guess, but there's occasional times when somebody's circumstance, I'll feel like they've been responsible with their time and some terrible things happened and, you know, they run a little short. I will approve, but I don't approve it often, you know, because you know, we have patients and clients and families that depend on us, and we need to be consistent in our service delivery.
Correct. And that's what our process says. Our process says that it can be utilized, but the use of leave without pay is discouraged.
Yeah.
Is the way it reads. So.
It says, is the site supervisor my current supervisor, or does it change to someone through GoHire? You will, when she's saying site supervisor, she's meaning, you know, you're an employee, but you'll be working at our site. LCDHD will be the site you're assigned to. And when you get to your site, you're assigned a supervisor, a site supervisor, an LCDHD supervisor. Long answer short, yes, it'll be your current, whoever's your present supervisor, as far as LCDHD is concerned, will still be your present site supervisor, and they will be the ones that would approve your leave and so forth. All right, Krista?
Yes, you're correct. Correct.
I've had a question here. They wanted to know how much PTO is accrued per pay period. Would you care to talk about that a little bit, Krista?
Okay. It is in the benefit guide where folks distributed the electronic benefit guide.
Yes.
Okay. It is on page 17. There is the accrual schedule, and the accrual accrues each pay period. So at the end of each pay cycle, there is that allotment amount depending on if the person is professional or paraprofessional. For example, a professional employee in year one accrues 6.25 hours, and a paraprofessional accrues 3.13 hours. And then it goes up each year thereafter, according to the schedule on page 17 of the benefit guide.
Is there anyone else with any questions? We've been on for about 45 minutes. I had scheduled an hour. People can stay on and talk as long as they want. I'll have to leave in a few minutes, but feel free to ask more questions. Anyone that has one. I don't see anything else being typed in. Carol, do you have any parting?
Well, I was going to ask Krista, of course, to help us walk through the process of moving to GoHire. Of course, they would have to resign from the health department. And then what would happen at that point, Krista?
Okay. Any individual interested, like you said, would have to go through the normal resignation procedures from the health department, and then put in an application on our website, www.gohire.org. And then from that point, our recruiter for the health department, Ms. Rhonda, would pick up from there and work with the individuals to complete our new hire process. And that process just consists of your normal paperwork that you would do with job, you know, tax forms. There are background checks that Rhonda completes online. Those are through the administrative office reports. We do have all employees do a drug screening. He would provide employees information on that, and complete all of the hire paperwork. Then she would meet with the employees to complete the orientation process. And Rhonda just told me that you typically don't do the drug screen, so that is at the discretion. It's a normal part, but if the site waives those, then we're good with that also. So if that's the decision that you make, then we can go with that. As far as the orientation process, Rhonda would meet with employees and get you enrolled in all of your benefits, discuss the GoHire policy, review how timesheets, leave forms, travel forms, all of those documents, processes, and procedures for GoHire work, and answer any questions that you have. And then throughout the course of employment, if you have a question or something you don't understand, something that you need help with, Rhonda is always the contact. She's always available to help you, to assist you, to point you in the right direction, and make sure that you are getting everything that you need and that you're happy in your employment with GoHire.
Let me ask you this. Does the employees need to have any reservation whatsoever that if they resign from us, for some reason you won't hire them?
Absolutely not. If they are meeting your requirements right now, then we're perfectly good with that.
Okay. So I don't want them to, well, this is just the latest to squeeze them out of work. That's certainly
right.
not. That's not LCDHD's goal. That's not GoHire's goal.
Absolutely not. Our goal is to, have folks that are happy in their employment. And like I said, we're always here to help in any way that we can.
You all are trying to provide employees that we will be happy with. So if we're already coming at it with people we're happy with, that just makes your job easier, right? So
absolutely.
Yeah. So don't, for any of the employees listening in, don't feel reservation that you're going to somehow be squeezed out of a job. That's not.
Like I said, we were organized for the main purpose of helping people stay employed, and that's always our goal.
All right, any other questions? Does anyone from GoHire or LCDHD administration, Ron, Carol, does anyone have any final thoughts before I stop recording and end the meeting?
Well, Ron has had to step out, so I'm not sure if he has anything, but I just want to encourage everyone that if they have any additional questions and or they think of anything after we're off the group chat, just email them to me, and we will discuss them and then get that answer back to you as soon as possible.
One last thing I want you guys to do, if there was any technical problems using this format, if you couldn't hear well, if there was feedback, if you had trouble getting into the meeting or whatever, would you please type that in the chat box so we will know? This is a new Zoom meetings. We're going to be using Zoom for a variety of things. So we want to know whether or not this technology is working well. So give us feedback if there was problems with the Zoom meeting. Otherwise, I'm getting ready to stop the meeting. I don't see any new questions. Thank you all, GoHire, for participating, and thanks to the employees for listening in. And I will see you all later. I think we're meeting again tomorrow afternoon, right, for round 2 of this.
Yes, there was one more question that just came in.
Okay, is GoHire something that is stable and will be around for a while?
We certainly hope so. As I said, we began with our first contract in 2011 with 365 employees, and since that time we've grown to over 980. So our desire and our goal is to keep growing, and to keep providing services. So yeah, we have no plans to go anywhere. As long as folks will have us, we hope to be around.
Yeah, just so them know, I mean, GoHire is a private company, and a private company stays in business by making more money than they're spending. And, there is a charge that they charge the agencies that use their service, and they're as long as their charge is sufficient to cover their costs and create a little profit for them, they should be a business that stays in business. As long as the business is making money, there's no reason for it to close. So.
And as far as our financial stability, we are stable.
Yeah. So there's just no financial reason why GoHire would go away. I mean, it's a private business that's making money. They're paying their staff and so forth. So you don't close a successful business.
Yeah. Hey, this is Brandon. I would also add that we have a independent financial audit of our financial statements and operations every year, just like any other nonprofit would. That's actually getting ready to happen next week for the previous fiscal year. So that check is there to make sure that there's nothing suspicious going on here, or no sort of impropriety or misappropriation happening with our financial situation.
Yeah, and you guys have to comply with FMLA laws and wage and hour laws and all those kinds of things too, right?
Absolutely. Yes.
All right. Anything else, anybody? Guys, you all asked some really good questions. Christy Parmley was a superstar question asker today. For having the courage to ask what she needed to know about. That's what this was for. So we're thankful for that. I'm getting ready to end the meeting. Guys, thank you all for your participation. And Krista from GoHire and the rest of you guys, we'll see you all tomorrow.
Thank you. See you tomorrow.
All right.
Bye.
Bye-bye.